So today is March 21st of 2020, and it just occurred to me that if I start making this little video diary now, maybe if this whole thing turns into a really big deal, it might be interesting to see how it goes. I'm Kevin. I am a emergency room nurse at a hospital in Kalamazoo, Michigan, and we are at the very beginning of this COVID-19 coronavirus outbreak. I'm out in the woods right now with my boy Willie Nelson because there's no place else to go. I have to socially isolate myself, and particularly I have to socially isolate myself because if anybody's going to get this virus, it's going to be me. So I just have a social responsibility or a civic responsibility to isolate myself probably more than other people might because I am on the front lines. It's a little scary. My wife is absolutely panicked, starting to take some cautions. Uh, PPE is in very limited supply. I have surgical masks, and we used to keep surgical masks in every patient room. We've moved them out because patients are stealing them. Patients are stealing our PPE from the healthcare providers who are there to save their fucking lives. But nonetheless, that's going on. We only have surgical masks. We have been running out of PPE, and they don't want us using the disposable stuff. Members of the community, church groups, and stuff like that sewed a bunch of face masks for us, so they're handing them out for us today. So this will be my mask for the foreseeable future. I will not wear it in isolation rooms. In isolation rooms, I will use hospital PPE, but for bouncing around the ER and not getting droplets, I'll wear this mask, and I will take it home and wash it myself along with my scrubs in between every shift, and otherwise I'll wear it. So it's pretty cool. Not the most comfortable thing in the world, but it's pretty awesome the way the community's rallying to help us out. It's slow. It's scary how slow it is. This is the slowest it's been. People are staying home, and I don't know. It feels like it's the calm before the storm. You know, in the ER, we don't like it slow. We don't like to have time to think. We just like to do. So processes seem to be in a lot better place. We do not have enough PPE. The public was making masks for us. Local restaurants have been feeding us. People are really appreciating what we're doing, and that's very cool. And the psych piece is there. So here's where we are. A lot more suicidals, not a lot more, but you're seeing more people coming in with psych-related issues related to this COVID thing, whether it's because they can't get access to their meds or to their providers, whether it's that all this craziness and being locked in their houses getting to them, whatever it is. The psych piece, I feel like we're starting to feel also. I think that's going to be something that will be a part of. They've assigned, this is the craziest thing, they've assigned N95 masks. You get fit tested, they give you this N95, a disposable one-time use mask that you are to use up to 10 times. And you wear it into the probable rooms. I say probable because we don't have any way to know who's positive at this point. This is their first coming in. So you wear this mask, then you take it off, you put it in a paper bag, and you save it until the next time that you go in the room. So you get your fucking COVID germs all over the outside of your N95 mask, put it in a paper bag to molder, and then put it back on your face. And here's my lessons learned from this. It's coming. We're starting to feel it now. The last couple times out, I said, it's really slow. It's eerie slow. It's starting. It still hasn't hit full force, but we've intubated, I think, 3 probables, one of which I know is confirmed. We've admitted bunches. We're converting units. The trauma unit is now on a different floor. Basically, they moved everything COVID closer to the ER because we just rush it in. It's a little somber. In the hospital, we joke around a little bit. Everybody says, you're going to get it. There's no way. If this stuff lives on surfaces for days, maybe, is airborne, spreads airborne, not droplet, and also droplet, and is as contagious as it is, the idea that an emergency department could possibly keep it out is insane. We might do a good job of keeping it out of the rest of the hospital, but there's no way it doesn't make it to me. I'm gonna be exposed no matter what I do, and that's just a reality. So I hope I'm healthy enough and still young enough to hang in there and fight it out. And I think we're ready except for PPE. Mood-wise, my wife is just losing her mind that my daughter and I work there. Famous people are starting to die, and you know the world freaks out when famous people start to die. Younger people who are reasonably healthy, the things that we're calling pre-existing conditions now, oh, he had asthma. There's a few healthcare professionals are starting to die, so it's hitting close to home. The team is starting to take a hit. Yesterday I worked what we at my hospital call the red team, which is the most critical. If you're trying to die, that's where you go as red team, and that's what I did yesterday. We intubated two COVID patients, and we allowed one to pass on who was at end of life already, and we did our best to make him comfortable, and we let him go. Anyways, and as per his wishes, and then as far as what's going on in the hospital, nothing new. Well, that's not true. We can now same day turnaround COVID testing, so we can know positive or not positive same day instead of waiting a week or two. That's going to be a big thing. We're still intubating, people are still dying, but not that high. So I want to say the numbers last week, for my county that I live in, I want to say that there were only 100 or so, 120 confirmed cases, and between our whole system, so not the other hospital, but our system, I want to say the deaths they weren't more than 10. So that's where things. On another note, the fucking lockdown is killing me. It's killing me. It's so hard for so many reasons. I can't do anything. I was practically on lockdown before the lockdown. So my wife is a staunch, avid supporter of locking down the entire fucking world until this thing goes away. So, I'm isolated to a room. I don't even get to touch her. I go to work and we're all like, yeah, whatever. We're all chill. Like we're just at work. I mean, the environment. The obviously the self-protection is a lot higher, but we're all just taking it in stride. And then I come home, the safest place in my world, and I'm treated with like this infection control process that's way, way higher than the infection control process at work. It's hard. Well, she's focused like a laser on the whole story, all day, every day. But anyways, that's my update. I'll probably edit most of this shit out. So Rachel has a stomach bug for a day, and they make her take 2 weeks off. I call them in the morning and say, hey, I have a cough, a dry, non-productive cough, and I have a known exposure. And they say, wear a mask. The difference between cardiology and ER. We don't give a fuck. Here's the deal. It was just announced today that health systems, well, actually over this week it's been trickling in, but health systems throughout the state are making drastic cuts. The impact of not being able to do any elective procedures, which is where all the money is, combined with having to spend millions stockpiling PPE for this corona COVID-19, has had a big impact. East sides of the state health systems are doing this. The big health system to the north of us has done it, and my system made the announcement today. Our top executives are all taking significant pay cuts. Our CEO is taking a 25% pay cut. This guy just started with us 3 weeks ago. He's taking a 25% pay cut, and all of our top execs are taking a pay cut, significant. Non-essential workers, non-caregiver workers, many of them are being furloughed, they're calling it. So they're not really calling it laid off, they're calling it a furlough. They're doing what they can. I mean, they're doing it with as much integrity as they can. They're maintaining their health care benefits for these people. They're saying they fully intend to call these people back, but they're furloughing people without pay at least through the end of August. It's April right now. At least through the end of August is what they're saying. The impact on me, I'm an ER nurse, so I'm considered essential, and I ought to stay employed. But in a bizarre twist of fate, I'm out of work. So yeah, I'm on a furlough, which is it's a result of the economic hits. I'm on a furlough. They've furloughed 20%, I believe it is, of the ER staff. They tried to do it in a way. I don't fully understand the way. I don't fully understand it. I don't. I am very curious. I thought I was pretty essential, and I don't think it was anything personal. I really don't believe my leaders wanted me out. Nothing like that. I think that but I thought I was more essential than I am, and that's a little bit hard to take. That's kind of where I'm at. I've been out of work now for not quite a whole pay period, but I waited a few days to make this video because I wasn't sure how I felt about things. I'm still not sure how I feel about things. So this now. I still have not been called back to work yet. I am still on furlough. I'm in my 3rd week now on furlough. I've gotten a lot of stuff done around the house. I did talk to the boss yesterday. Things are ramping up, and the expectation is that I will probably get called back to work soon. I actually thought I might get called back to work this week. I gotta make this video to just sort of say, man, I can't even tell you. So I have been in healthcare in one role or another my entire life. When I was 18, my first job out of high school was patient transport, pushing people around the hospital in wheelchairs. I did that as a volunteer even before I graduated high school. I have been in healthcare my entire life. I'm in my mid-50s now. To have there now be the crisis, now be the big, oh my gosh, where they need us, and I'm not in the game, and to be taken out of the game at this time when this pandemic and this crisis is so big, it just feels so wrong. I don't even know how to express how wrong it feels to not be out there fighting this thing with everybody. I think there's a good chance I'll be called back in the next week or so. And with the pandemic, with the COVID-19, with the virus, really now starting to affect children differently, and you know, the more we learn, the more it sounds like we don't really know a lot about this thing, and that this might go on for, you know, months and months, maybe even all year or more. My living situation might change, meaning I might have to really separate in the house differently. Yesterday was my first day back to work. You know, it was the first day back after being furloughed for a month due to lack of volume and our hospital having taken a huge financial hit and really needing to fight to stay viable. The whole COVID thing seems to be, they're past the panic stage. You know, I guess, to use the terminology of the day, the curve maybe has flattened. Cases are still coming in, they're still testing, but they've got the process down. Nobody's freaking out about it like we were a little while ago. They put me in an area, you know, I mean, a month away from the ER is tough, and you know, I haven't had to operate under fire for a month, and there's a big difference in the way your mind works. I was in an area where the people generally are not all that sick, so it was good to get back and start a few IVs, run a few protocols, and be sure that I know what the hell I'm doing. I did have one guy come in, chest pain, not that sick, converted to a big MI, and I did have to operate under pressure. That was probably a good test for me. You know, he went really Brady. He went really hypotensive. I had to basically just run him through the big MI protocol and get him up to the cath lab. So it was good for me to have to work under pressure again. I miss that. I need that. I don't know what I'm ever going to do when I don't have that in my life anymore. But I don't work today. Thought I'd show you how I'm living on lockdown, because I am, you know, I'm high risk, and so I don't share my germs with the rest of the house. So this is just a little bit of the sacrifice that I'm making. Here's how I'm living these days. That's my best friend Willie Nelson right there. This is my gym for the time being. Whereas way over here This is my living room for the time being. And if we come way, way, way over here, this is my bedroom for the time being. If we come over here, this is my shoe closet and my dressing room, or at least where I keep my clothes for the time being. This is my bathroom for the time being. That's my friend that greets me every morning when I get out of bed. So that right there is where I spend my days when I'm not at work, which is why I've been spending an awful lot of time outside lately. It's just all I have. Been back to work now for 3 weeks probably, back in full swing. It's getting busier. I just worked 3 12-hour shifts in a row. I was on the red team or the hot team, so I did a lot. And I definitely intubated several COVID patients that are not doing well. And one of them was a man, young. He had obesity, but really no other, well, and like some heart stuff. But at any rate, I don't think he's going to do well. And it's been a lot of old people, but it's definitely out there. It's just part of life now, so it's not chaotic anymore. I don't know why I didn't see this coming, but of course, now this is all political. I mean, do you wear a mask or not is political. Again, I'm in Michigan, which is a real hot spot for the politics of how to manage coronavirus. And it's amongst my peers, it's amongst patients. You can't just do your job without the politics. And while I have a lot of opinions, I tend to not want to get into pissing matches with people who don't know what the fuck they're talking about. At any rate, increasingly, man, I just feel like withdrawing from society. I'm getting into camping, even just out on my own property or behind my property. I'm practically living outside because I'm quarantined in one room in my house because my wife is scared to death, rightfully so, of the corona. She's, I don't want to say she's high risk, but she's at risk. So this stuff has taken its toll on me, man. Doffing and donning my PPE constantly, now listening to everybody bicker and, oh, tensions are high. Oh, and people are getting sick. So the mental toll that this has taken on me. I'm a peace-loving man. I just don't want to fight with anybody. I just want us all to get along. I just want to heal the sick. My daughter, who also works at the hospital, was on her ride home from work and stopped at the gas station to pump gas in her scrubs. And some lady who had no clue who she was or anything was at another gas pump, took the time to walk over from her car and give my daughter a ration of shit about the fact that she was out in public spreading her germs. And so basically it's healthcare worker harassment. In my view, it's healthcare worker harassment. My daughter was nowhere near anyone else. She was literally at a gas pump. She was way outside of 6 feet away from anybody else. She was outside, and this lady came up and gave my daughter a load of crap about the fact that she was not being socially responsible because she was out in public pumping gas in her scrubs and not wearing a mask, even though she was outside and way, way more than 6 feet away from anybody. Following guidelines. But so that's the first thing that's hit really close to home for me, of people in the community starting to be negative. Fear, it's fear, but people in the community coming down on healthcare workers who I mean, it isn't like, one day last week we rode to work together, and on our ride home from work we talked about how much we would like to stop and have a beer, because at this point bars were still open. Right now bars have closed again, but at this point bars were still open, and we talked about wanting to stop and have a beer. But the fact that both of us were in our scrubs, one, we thought people would give us crap, but two, that would have been irresponsible. Even with masks on, that would have been an irresponsible thing to do in our scrubs, still dirty, not showered or anything like that. Both of us having spent the day in the hospital, we recognized that certainly would have been an irresponsible thing. But to take harassment from some lady at a gas station who had to walk across a parking lot to get to you because you were isolated from everybody else. I don't know. That's kind of crazy to me. As we've been going through the COVID-19 thing, and as we've started to settle into, I think, our groove a little bit more, I find myself paying a lot more attention to the human element, the psychosocial aspect of everything that's going on. And one thing that I noticed that I just think it's worth noting here, like we're becoming callous to it. We're becoming a little, here in the ER in particular. One thing I noticed this morning on my way into work, you know, it's a hospital policy. It's just common sense too, but it's a hospital policy that you wear a mask when you're on hospital property. Hold on, there's a code. No, that's a good one. It's a hospital policy that you wear a mask when you're on campus. As I walk in the morning and out after my shift, I really notice that my peers in the ER flaunt that rule. They just don't wear masks. I mean, we don't wear masks during report. I mean, we wear it on the floor because you have to, because somebody could walk through. But like coming into the building, doing your thing, we just don't. We get more and more lax about PPE as compared to staff on the other units and on the other floors where absolutely they're wearing their masks and they're wearing their gowns. And I started asking myself, well, why? Why are we that way? And I feel like, here's what I think it is. I've been thinking about it all morning because I really noticed it this morning walking in. Nurses, techs, everybody from other units are all wearing their masks, and like no one from ER is wearing masks walking in to start the day at the time clock, whatever. It's crazy. But here's what I kind of think. We're the most exposed, even in the COVID units. The staff there, they know that their patients are COVID. They know that you gown. It's just part of the whole thing. Here, you're not supposed to unless you're testing, and you're only testing half of the people, and half of the time you've been with them for an hour before you test. We are exposed every day. We know we are. The exposure is nonstop. So some of these things seem, I don't want to say redundant, but they seem pointless because we are exposed constantly. And it kind of reminds me, this morning I've been processing this. It reminds me of that scene in Apocalypse Now, I believe it's Apocalypse Now, where Robert Duvall the bombs are going off and everybody's diving under everything, and Robert Duvall's just walking around going, okay, let's do this, let's do that, and he's just totally not ducking because what's the fucking point? I think that's where everybody's mentality is here in the ER. It's like, what's the point? If we're going to get it, we're going to get it. If we're not, we're not. But doing all these, jumping through all these little hoops for us, we're exposed. We're either going to get it or we're not. So that's kind of what I think. Today is August 5th. It's been roughly 6 months-ish since I started this video series chronicling my experience as an ER nurse through the COVID-19 crisis. I realize it's been a while since I've made a new video, and I think that that's because there just isn't a whole lot new to say. And for that reason, I'm going to make this my last video in the series. Because I can't go to bars, I can't go to restaurants. It's just not fair to society. They don't know. When I sit down at a table, 6 feet away from some elderly couple who are at high risk, they don't know that they're sitting 6 feet away from somebody who's had known exposure to known positive COVID people for the last 3 days in a row. And so I feel like it's irresponsible of me to do that. But I've got this group of friends who are very aware of who I am and what I do, and they've made the decision to still kind of socialize with me once a month or so because we do live far apart, and be outdoors and practice the best distancing we can. And thank goodness I have those friends, because isolation is driving me nuts. I think that that's what this has become for me. We know how we're dealing with COVID. Isolation is driving me nuts. Being isolated in my own home is killing me. Having my wife scared to death to be within 6 feet of me is killing me. It's hard. It's hard. Hopefully I have put together something watchable, and hopefully somebody will watch this and enjoy it, or at least take something away from it. Thanks. Peace. It's 2023 now, and I'm 3 years removed from when I made all those videos, and I'm also 2 years removed from the emergency room. I only just recently went back and started looking at these videos and trying to splice them together. It's interesting. I think armed with the hindsight of 3 years of reflection, this video is going to look a lot different than it would have looked had I put it together right after the fact. Um, I did notice when watching the videos, I spent a lot of time talking about here's what we're doing, here's the nuts and bolts of what's going on. I didn't spend much time at all, or any time really, talking about the tragedy and the sadness and the death and everything that happened with all that COVID. And when I asked myself, well, why didn't I talk about that? I think that at the time when you're caught up in the middle of all of it, you can't think about it. You can't think about what's going on while you're working with what's going on, or it would get in the way of being effective at what we had to do. So that's why. But I thought in this recap, I've had the chance to process some of that emotion now, and I'll recap it. Kind of the major things for me, I talked a lot about it during the video, the isolation. The isolation for me personally was hugely impactful, and still is. 3 years later, I still isolate. I'm changed. I'm definitely changed from it, from the whole experience. From the whole experience, I'm changed. I'm a different person. Whether I'll ever get back to who I was, I don't know. But there's that. What are the as far as all the death and all that sort of stuff? I mean, death is tragic. Death is tragic whether it's a stroke, whether it's a heart attack, whether it's a trauma, or whether it was COVID. So I don't know that the death. I've been around enough death to not necessarily be impacted by a specific event versus just the overall lifetime working in this field. But the things about that stood out to me, uh, the no visitor policy. The no visitor policy was horrible for people. I mean, I look back and I remember some specifics. I remember an old guy, probably mid-late 70s, having to be restrained by security at the door as he tried to force his way back to see his sick wife, who of like 50 years, right? And he can't get back there to see his wife because at the time the policy was no visitors except in the case of impending death, and at that moment her death was not imminent. It was, but it wasn't imminent in that moment. She was gonna die, but not in that moment. And she was scared, and he was trying to force his way back to visit her, and our security guards had to restrain this old man desperately trying to get to his wife. That was pretty impactful on me to remember that particular situation. Um, all the people coming in deathly ill, uh, either wishing that they had not been stubborn and wishing they had gotten their vaccine, or in disbelief questioning how it is that they could have gotten the vaccine and yet still have this disease. Or the one guy, the guy who's going to stick with me through that whole ordeal, the guy who will stick with me forever. This old farmer who came in alone, sick, oxygen saturations like in the 50s, could barely breathe, drove himself in because that's what old farmers do, came in thinking he was going to be home that evening, and absolutely insistent that COVID wasn't real and something had been done to him. It was all part of a scheme, and this wasn't COVID. And literally, I'm trying to save this guy's life pointlessly because he was too far gone. As we're getting ready to intubate this guy, just look at me straight in the eye. Don't you dare give me that vaccine. I mean, defiant to the end. Don't you? And I promise you, sir, I will not give you the vaccine. I mean, the vaccine would have been pointless. He was already dead. He just didn't know it. But I remember him just absolutely aggressively denying that COVID existed. He could barely talk. He was having such a hard time breathing, but defiantly insisting that COVID wasn't real. Don't I dare give him the vaccine. All of this was made up. And I remember being angry with him because there I was in the middle of this fight, and it was horrible what we were going through. It was horrible what people were going through, and this guy yelling at me, insisting it wasn't real. And part of me wanted to shut him down. Part of me wanted, and then the better part of me remembered that whether I agree with this guy or not, this guy was dying. This guy was actively dying in front of me. He may or may not have realized it. I think he was very scared. I know he was scared. Either way, I comforted this guy. I didn't reinforce his nonsensical beliefs, but I also didn't argue with him, and I comforted him because he was there alone as we prepared to intubate him and send him up to the ICU where he would later die. Because not a lot of people died in the ER. You know, I mean, we can do a lot of things to keep your heart beating. We can do a lot of things in the ER to keep you going for a little while. So most people, we were able to get them up to the ICU where they then died. But so those are the things that kind of stood out in my mind about the COVID, was the visitor policy, the politics of people denying it, or people absolutely going overboard the other way. And for me personally, the isolation, which I am still maybe not over. So that's my recap. I'm gonna wrap this video up and post it out on the YouTubes.